Thank you so much for that great introduction, Agnes. And good afternoon, everyone. Thank you so much for having me here today with you and sharing this time with me. Thank you for your making time in your day to listen to this important information. As Agnes said, I'm a citizen of the United Home and Nation of Louisiana and one of the Tribal Public Health and Aging Associates at the International Association for Indigenous Aging, also known as IA squared, because it's just shorter and easier to say and easier to remember with the two I's and the two A's. And so, like she said, I'll be sharing a resource we developed called Creating a Tribal Elder Safety Net to Address Wandering Persons, or as we often refer to it simply as the Wandering Toolkit. Okay. So a little bit about who we are and what we do. At IA Squared, we serve American Indian and Alaska Native elders and their communities by helping people and organizations learn how to better reach and support Native American elders. Our organization works collaboratively. We work with our network of people from all sectors and multiple professions. We bring their experience and expertise together to tailor programs and materials to serve AIAN, American Indian, Alaska Native populations. Elders are at the center of our initiatives and projects. Sorry, I missed my slide. So elders are at the center of our initiatives and projects with their health and well-being as our ultimate goal. We work on healthy brain and elder justice initiatives. So the top photo shows our homepage, which includes our Healthy Brain resources, and the bottom pictures of our Native American Elder Justice Initiative, or NAGI, with more resources related to elder justice. And that includes things like elder abuse, elder neglect, financial abuse and neglect, things like that. Now, this topic of wandering fits between both as an elder health and safety concern. So I have a question for you guys. Have you ever had experience with an elder who wandered due to Alzheimer's disease or related dementias? And it could be a family member, a friend, or someone else in your community. And if you'd like to just pop in the chat, yes, if you have, I'm sure we'll see a majority of people, a lot of people have. So feel free to interact in the chat. Yes, yes, yes. Yeah, I see a lot of yeses. So funding for this project comes from a grant from the Department of Justice, Bureau of Justice Assistance, Kevin and Avante program. Kevin and Avante's law was passed in 2018 in honor of two young boys with autism who tragically drowned after wandering away from safety. It allows the BJA to support local groups such as healthcare, law enforcement, public safety, and nonprofits, prevent and reduce the number of injuries and deaths in those who wander from safe environments due to dementia or developmental disabilities. The funding goes to programs that work to prevent wandering, increase the safety of vulnerable individuals, facilitate rescues, or use locative technology. The Autism Society of America provides training and technical assistance to the sites that receive funding through the Kevin and Avante program. And there's a map on the BJA website of all the grantees. And I just kind of zoomed it in, and you can see here, IA squared here, where the orange arrow is pointing as one of the grantees. Now, one of the reasons we took this project on, and it is very meaningful to our organization, is because of our co-founder, Dave Baldridge. Dave is a member of the Cherokee Nation of Oklahoma and an accomplished leader and advocate for older American Indians. For many years, he was involved in search and rescue as a canine handler for Sandia search dogs, assisting with search and rescue missions in central New Mexico. And Dave was also, if you're familiar with NICOA, one of the executive directors of NICOA, National Indian Council on Aging, for about 10 years from 1992 to 2002. So he's been very involved in advocating for elders for a long time. Unfortunately, Dave is currently living with a form of dementia called progressive supranuclear palsy, which causes both memory issues and problems with movement. Dave is open about sharing this with people and has even written articles about it for Indian Country Today News and the Dementia Action Alliance. To complement Dave's knowledge and expertise on the topic, we also collaborated with tribal law enforcement and other search and rescue experts to develop this toolkit. So I just wanted to take a moment to honor Dave and all of his incredible work in this space. So what is the purpose of this toolkit? I'm sure most of us know about the baby boomers and the rapidly aging population. Over 10,000 people turn 65 each day. Approximately 18% of the US general population is over age 65. This number is expected to nearly double from 55.7 million to almost 95 million by the year 2060. According to the Administration for Community Living, the aging AIAN population will more than double from over 300,000 in 2019 to over 600,000 in 2060. Now let's look at another set of data. In the year 2015, our organization, IA Squared, in partnership with the AARP Public Policy Institute, conducted an analysis of the AIAN population. They found that between the years 2000 and 2010, the AIAN population grew 27%, which is 3 times faster than the total general population. Meaning that as this younger American Indian and Alaska Native population ages, the proportion of elders will increase, and the number of AIAN people age 65 and older is projected to more than triple from 464,000 in 2012 to 1,624,000 in 2050. This right here is a bar graph of people aged 50 and up, showing the American Indian Alaska Native population in the darker blue color compared to the general population in the lighter blue. So we can see that the AIAN population is greater, and it will be greater as it continues to age. And you may be wondering why the data sets are different, and I think it's important to look at that. Both projections are based on credible census data, but apply different approaches. So the Administration for Community Living, ACL, their info bases its estimates on the US Census Bureau's official counts and often uses a narrower definition of just AIAN alone, not in combination with other races. IA Squared and AARP use the US Census American Community Survey, ACS data, but that includes people who identify as AIAN alone or in combination with other races, leading to a larger base population and higher projected growth. Baseline timeframes also differ. That's why it's important to know what's behind the numbers. This demonstrates the complexity and inconsistency in who is counted and how, which can really affect projections. What matters, though, and the key points here, are that both show significant growth in the AIAN population, which has implications for elder health, dementia and wandering prevalence, caregiving, and therefore emphasizes the need for culturally responsive services. Now, moving on from that information, we can expect to see a couple of things. First, we can expect increasing rates of Alzheimer's disease and related dementias, or ADRD. As shown in the graph here from the Alzheimer's Association, ADRD in the US is expected to more than double from almost 7 million people in the year 2023 to 14 million by the year 2060. All right, now I have a question for you guys. With an increase in ADRD, we can also expect to see an increase in wandering incidents. So here's another question for you. How many people with ADRD will wander at least once? What do you guys think? 20%, 45%, 60%, 85%? You can share in the chat what you think. 45, 85, 45. A lot of people saying 45%, 45%, 60%, 60%. The answer is 60%. 6 in 10 persons with dementia will wander at least once. The Washington Post conducted an in-depth investigation revealing that since 2018, over 2,000 residents have wandered away from assisted living and dementia care facilities in the US, with nearly 100 of those incidents resulting in fatalities. But this is only what's actually been reported and the data that is available. There is no mandatory reporting on missing persons with ADRD. So that means that possibly even more wandering incidents are actually occurring, and we can expect to see even more in the future. So IA² created a toolkit for Native populations to help address this issue. Why do we need a toolkit culturally tailored to Indigenous communities? Well, because of our unique challenges. One, due to a variety of factors that have impacted our cultures over many years, Native Americans experience higher rates of chronic health problems, diabetes, hypertension, obesity, and more, which are all risk factors for dementia. Two, we have higher reported rates of mild cognitive impairment and dementia, as shown in this graph here in the dark red, as compared to non-Hispanic whites, African Americans, and Hispanic Latinos. Additionally, we must take into account our unique experiences with trauma. 60% of adults in the general population have experienced trauma. 4 out of 5, or 80% of American Indian and Alaska Native adults experience violence in their lifetime. And of course, we need to recognize historical trauma as well. This is important to keep in mind in understanding what may trigger a wandering response, a person's motivation to wander, where a person may wander, and how they respond when they're found. So the goals of developing this resource are: 1, to enhance the safety and well-being of elders in AIA and communities who may wander; 2, equip caregivers and community members with tools to prevent and respond to wandering incidents. And this is done by creating a community education and a community response in collaboration with local law enforcement, which allows for speed in locating the elder. Data analysis shows that survival rates for wandering elders decrease dramatically after 24 hours, increasing the urgency of finding them quickly. In fact, according to the National Council of Certified Dementia Practitioners, there is only a 50% chance of survival if a missing person with dementia is not found within 24 hours. Survival rates can also be influenced by environmental factors. As we know, many Indigenous communities are in remote areas with harsh terrains. By providing this resource, we hope to help communities feel more prepared and keep elders safe. Another goal is to support tribal sovereignty by providing a customizable resource which communities can lead and adapt to their needs. This toolkit is meant to be a guide, but it is encouraged that you adjust it to the needs and structure of your particular community. In addition to tribal sovereignty, the toolkit also includes a detailed elder form to be used in the event of a wandering incident, and we included guidance on protecting personal information when filling this form out, honoring informed consent, which relates to individual and data sovereignty. And finally, the toolkit aims to foster collaboration, not only within the community, but also with law enforcement agencies to aid in community policing efforts, especially in communities that may not have a lot of resources, or may be geographically large or extremely rural. We encourage communities to create MOUs, or memorandums of understanding, or cooperative agreements with their local agencies having jurisdiction, as well as surrounding communities and their jurisdictions, to be able to work together and bring our elders home quickly, especially if an elder wanders and crosses the border into another county or jurisdiction. It's important to have those cooperative agreements. So another question for you: what law enforcement agencies would your community work with in a search and rescue situation? Whoops, could be tribal police or county police, nearby metro police, state troopers, or some other agency. I'd be curious to know what you guys, who your agency having jurisdiction is. So nearby metropolitan police and tribal police. Okay, so now I'd like to show you how to access and utilize the toolkit. Let's see, I see some chats coming up. U.S. Border Patrol. Oh, wow. Okay. C, within an urban area. D, state troopers. Sure, we can, I'm happy to share the PowerPoint. If that's okay, Agnes, if you usually do that, that's fine. For those who joined late. So yeah, so let's have a quick look inside the toolkit and get familiar with it a little bit. And if any questions come up about using it, please get in contact with us because we can offer technical assistance. So the toolkit is broken down into three main components. There's an educational section to help the user understand dementia and wandering, an action section, and a debrief section. So the first section starts with how to use the toolkit, then focuses on education, understanding dementia and wandering, as well as providing some tips about prevention. And it also has a link to the Alzheimer's Association because they have a lot of tips on prevention. But that's a bit outside the scope of the toolkit. The next section is a workbook with a checklist and worksheets, which guide the user step by step through creating a community response plan. It starts with contacting local law enforcement for collaboration. It also recommends reporting any missing person immediately to the agency having jurisdiction. However, it is important to know the tribal code with regard to addressing issues concerning elders. IA Squared actually has a tribal resolution toolkit on our website, which can be helpful in presenting something like this to your tribal leadership. Then it walks you through assessing the community, the people, the terrain, establishing communication methods, and a phone tree. There's a template for a missing persons flyer and a detailed elder profile, which kind of outlines information like what do they usually wear, what does their car look like, what is their license plate, what directions do they usually travel, what are their places that they visit or sacred sites, things like that. There's also guidance on conducting a mock search or a tabletop exercise and offers different scenarios so you can practice your plan before an incident occurs. Finally, there's a debrief analysis section to help look back at the mock search or tabletop exercise to see what worked and what didn't, and what could be done differently. The toolkit is customizable for each community and encourages using local traditional knowledge, tracking methods, etc. So now I will show you guys a few pages. Oh, and as I just want to mention, as you saw, the toolkit provides guidance on doing a tabletop exercise or a mock search. And we actually conducted a mock search with the Pyramid Lake Paiute tribe in Nevada a couple of years ago in order to help inform the creation of the toolkit. And we are currently looking to do more with a few more tribes. Okay, so here's a look inside. We're not going to go through the whole thing, but I just want to show you a few pages. So here's part one with the education about Alzheimer's disease and related dementias and wandering. And this toolkit is available on our website for download, and it is actually a fillable PDF. Next page, some info about wandering and what can trigger wandering incidents. And some tips on prevention. And we try to include culturally relevant imagery and terms and things. Next, we have part two of the toolkit, which is the step-by-step workbook that I mentioned earlier. So first, it has a checklist to help guide the user through all the steps. And it has like what to do, and there's a discussion about it, and the page number, and then the worksheet page that follows it. And we'll just talk about a few specific ones today. So for example, step one is to collaborate with local law enforcement and agencies having jurisdiction as well as surrounding communities. So there's info on that. The next page helps you think about who that might be. Like we talked about, it could be your sheriff or state patrol or border patrol or tribal police. And it talks about making the cooperative agreements. Let's see. And you can also reach out to your local law enforcement if you need help making those cooperative agreements. Now, actually, this year, I Squared is creating some templates for cooperative agreements to help guide people through that process, and they should be available later on our website and downloadable and customizable later this year. So then after you've thought about who are your agencies having jurisdiction, you've identified those, what you'll do is you'll write it in here. And like I said, it's a fillable PDF, so you can type it in there, the name like Border Patrol or Tribal Police, and then their phone number. So all the contact info goes there to keep on hand. Then step 2 would be identifying your community members and partners who are willing and able to help in a wandering incident and build a team for the community response. So this helps you think about who that might be, senior center, neighbors, friends, even delivery drivers or, um, you know, package delivery drivers like UPS or the mailman, or Uber. And if your community relies on, it also has airplane, trains, and boats or ferries because our friends in Alaska don't often have accessible roads and they have to use alternate transportation like planes and boats. So then after you've kind of identified people in the community, there's another worksheet that will list who will help and their role. These people, especially the coordinator, may be in communication with the agency having jurisdiction prior to and during a wandering incident. And then it just, the toolkit continues like this with, the different worksheets. So it continues with analyzing geography and hazards and helping you think through that, where your bodies of water are, where there might be wild animals or res dogs that you need to be careful of. Actually, in the Pyramid Paiute mock search, there were some res dogs that were actually out and about, and we were told like where to avoid those and to stay away or to walk around with treats to, pacify them. So it kind of helps you think through all these things, all through those steps in the toolkit. Also creating a phone tree, filling out the detailed elder form, and even a missing persons flyer template like we talked about earlier. Let's see. And finally, so a nice feature that we've added to this toolkit is the quick reference guide. So as I mentioned, the toolkit is a fillable PDF. And when the user goes through the workbook step by step and fills in the worksheets online, the worksheets will auto-populate at the end altogether. So kind of at the top, you can see the first worksheet. And then at the end of the very end of the toolkit, that same worksheet has been auto-populated again with the info that you entered. So this way, the most important information in the community response plan is all together, making it easier to print if needed, and to not have to search through the whole toolkit for your worksheets and all the important info and people's phone numbers and things like that. So it's kind of just like a little packet at the end. So you can just print it and keep it somewhere, whoever the coordinator is going to be, or you could pull it up quickly on the computer and just go to the end of the document that you filled out. And so that's easy access. And also, like if you wanted to print it, it's also done in black and white to save on ink and paper. And especially places that are more remote and rural, they appreciate having a printed copy and not having to use so much of, so many resources to keep it. So just a quick side note, if you or a community you work with wants to learn more about dementia and interacting with people with dementia, I Squared offers a program called Dementia Friends. So Dementia Friends is a global movement that aims to change the way people view dementia. I believe it started in the United Kingdom. And there are actually programs all around the world. Most states have their own Dementia Friends programs. So it would be like Dementia Friends Arizona. I live in Atlanta, Georgia, so it would be Dementia Friends Georgia. However, IA Squared has specifically adapted Dementia Friends for American Indian and Alaska Native individuals and communities. And we have the license for that. So if you're interested in that, feel free to reach out to us for more information. And what you can do is actually, you take the training and become a Dementia Friend. Then, if you'd like to teach Dementia Friends in your community, you can become a Dementia Friends champion. And then you receive all the materials, and it's basically a script that you read. So you don't have to really learn a whole lot of new material. You just read the script when you do a Dementia Friends session for people in your community. And, oftentimes people from the community receive information more easily and more willingly from one of their own community members rather than an outsider coming in. And so it's like a train the trainer kind of thing. And that way we can expand it and reach more people. And each person can kind of tailor it and answer questions relevant to their own community. So if you're interested in that program, please reach out to us and let us know about that. And also, I just want to let you all know, in case you haven't seen our other resources, but we also create a variety of resources for community members and health professionals to utilize. Some mostly about brain health awareness, dementia, things like that. We also have printed resources, online resources about elder justice, and some we create from scratch. Others we culturally adapt from existing resources, such as this blue one in the back, that blue flyer, and that's from the Lancet. And then the second one with the man with the hat is from the Alzheimer's Association. It's the 10 signs of dementia. We also worked with the CDC and the Alzheimer's Association to adapt the Healthy Brain Initiative roadmap for American Indian and Alaska Native peoples to be culturally tailored to AIA and populations, because the CDC and the Alzheimer's Association many years ago created a roadmap for brain health, but it was for the general population. And they were finding that when they were trying to implement it in tribal health systems and tribal communities, it wasn't working because it was made for state and local and national health systems. So they called on us, and with our network of people, adapted it to be appropriate for American Indians, Alaska Natives. And there was a 21-person advisory committee. 15 of those people are Native Americans, Alaska Natives. So it is culturally informed. And so we do things like that and create these resources to help bring awareness and help people dealing with dementia and promoting brain health. So we have flyers, we have rack cards, we have other toolkits, we have videos and all kinds of things. We are actually currently working on a trifold called Questions to Ask Your Doctor About Memory Loss. So if you're kind of starting to be concerned about memory loss, or a family member, caregiver is, there's some questions to help you talk to your doctor. And then we also are creating a symptom tracker to help you track or help a family member track the concerning symptoms. So it's easier when you go into the doctor, instead of saying, I've just haven't been remembering things lately, or my mom is forgetting a lot of things. The doctor's like, well, like what? And you can't really think of what, but this, if you track it, you say, well, mom put her keys in the refrigerator on this date and that date and that date, or mom got lost at the grocery store this date and that date, so that you have more concrete information to bring to your doctor. And so that should be coming out soon as well. And you can find all these things on our resources page with this website or this QR code. Oh, and just those rack cards are really fun. Elders love them, and people love to read. There's recipes on the back, actually. And not only does it give info about, healthy food and healthy things to do for your brain health, but there's recipes on the back, and they're really nice to put in like food distribution boxes or at elder events or dinners or things like that. So, and you can also order printed copies of these things on our website that are no cost to you because we have a grant for printing. So feel free to order resources. Okay, so one final question. Does your community currently have a plan in place to respond to wandering incidents? Yes, no, partial. Maybe, maybe thinking about it. Oh, I see. Okay. Trudy asked, are the toolkits offered in native language, including the flyers? We um we don't currently have them translated. Um, but we have talked about in some of our future resources, we're talking about doing some short form videos and having a voiceover in native languages. Um, but Trudy, if you would like to chat about that later, um, we can explore that. I used to be a Spanish interpreter and translator, and one of the companies that I used to work for would get requests for different languages for translation, written translation. And it was always very hard to find, especially for Dene or for the Navajo language, somebody who could write it and read it. But, you know, Trudy, if you have resources of someone who's able to do that, because most people can speak it and understand it, but we always had trouble finding somebody who could read it and write it. But to translate the materials, we would need that. But I'd love to talk with you more about that and explore that with our director and see if we can do some of that, if there's a need for that. Okay, so do you guys have a plan? Have you guys thought about wandering in your community? So if you don't, I hope that you will find that this resource is valuable in helping you create one. Now, if you are interested in implementing a plan and would like help, please reach out to us. Um, let's see, we are actually looking to work with at least 2 communities to implement the toolkit with, and we can help you develop your plan and do a tabletop exercise or mock search virtually or in person. You can also join our learning community to give feedback and help us refine it for a second version because we are going to update it once we've implemented it and kind of seen more of what happens like in real practice. We're going to update it and create a second version. And so if you'd like to join the learning community to help inform that or just give feedback and help us as we develop that second version, we usually meet every other month virtually. And I see Trudy put in about the silver alert in Arizona. And yeah, the silver alert is really good. There's the feather alert in California. New Mexico earlier this year just did pass the turquoise alert for specifically for Native Americans who go missing. The thing about that is while it's wonderful and it's great to have that, the problem is it takes time. It takes time, like you have to meet specific criteria. It takes time to get it approved, you know, to go up the chain of command to get it approved and then get it out there. And that's you're losing valuable time looking for your elder. So if you have a plan in place, then you can start looking and responding to find that elder right away while you're waiting for support from the law enforcement and while you're waiting for a silver alert or some kind of alert to be put out there. So it just gives a community the capacity to act faster and have some autonomy about it in the meantime. And so that's it on the Wandering Toolkit. I thank you for letting me share this time with you today. And you can find this and other resources on elder justice, wandering brain health here on the website or the QR codes. Feel free to email me with questions, comments, or suggestions that you think of later. Or if you'd like to chat more, explore the toolkit more. or any of our other resources. If you have ideas for other resources, we always want to hear from the communities that we work with, because you guys are the boots on the ground. You are the ones who know what you need. You know what will make your job easier or what people need. So we would love to hear from you if you have ideas or questions about the resources. Um, and so now I'd like to open it up to you all for questions and comments or stories about wandering that you would like to share. Go ahead, Agnes, if you want to, or anybody, if you want to come off mute or type it in the chat.
So this is Agnes. Sorry, I was trying to find my microphone button.
Yeah, I know. Same thing happens to me all the time.
So again, thank you very much for an excellent presentation on a very important topic and what we can do to help law enforcement. So, we do have, let me see, if you have any questions, you can raise your hands and we'll and unmute yourself, and we can have Megan answer your questions. And I know there have been some in the chat that you've addressed. The question regarding having it translated into different languages, and also whether, I know Rhonda had mentioned she didn't know if your program had worked with Navajo Nation, because she is a case manager with Navajo Nation Altex. So that was a question she has, because they have clients with dementia and Alzheimer's at home and at nursing facilities.
Okay. We have worked a little bit with Navajo Nation, but not specifically on this. We've had people from Navajo Nation join some of our listening sessions. Oh yeah, that's another thing. If you guys would, if you would like to join our listening session, this is different than the learning community. So the learning community is specifically for the Wandering Toolkit. But then also every other month on the even months, so we just had a listening session. We have listening sessions with just anybody who's used our resources. And so we just have a moment to gather and listen to what you guys need or what challenges you're facing in your community, what resources we can create to help you. How can we improve our resources? Just things like that. So if you're interested in joining the listening sessions, please put your email and we can add you to the next invitation for December. And that just gives you an opportunity to give feedback and hear like what our newest initiatives or resources are, things like that, because we want to hear from you. Because like I said, you guys are the ones who use the resources, so we want to make things that are appropriate. We don't want to just be thinking of things like thinking, oh, this is a good idea, and then it's not really a good idea in practice in the community on the ground. So all of our resources are like co-created with Native American or American Indian, Alaska Native communities. We co-create, and that's the idea. We try to not just make anything without any community input.
Great, that's a great resource. And looking at your website, you can download the materials and also print as well and order them as well. So those are good resources. So I didn't want to point you out, Rhonda, but did you have anything else you wanted to say in terms of working with Navajo or working with your program in particular?
Yeah, I'm a case manager. Good afternoon, everybody. I'm an hour ahead of you guys. So I have about 36 members on my caseload, and I have a handful of members that have dementia and Alzheimer's, and it's very difficult to find resources. When there was last year, I had a member that had gone missing. I didn't know. The family was out frantically trying to search for their loved one, and of course, Navajo Nation is it's very hard to get local law enforcement involved because we're very limited. So it would be nice to have these flyers available for my members as families so that they know how to coordinate with not just me, but also local law enforcement and hospitals. Because when my member went missing, I went out and I actually had to help find the member. And we were fortunate she was like only 10 miles away from her home. So those are some of the things we run into. And then we have those ones at the nursing facilities We have some with advancing dementia and Alzheimer's, and
Mhm.
then we have some that are um, behavior. They exhibit a lot of the behaviors, outbursts, and everything. So we have them in locked units. So the ones in the
Mhm.
locked units are more easier to navigate and to actually supervise and to locate because everybody's on them. But on the other side of that, we do have wanderers that accidentally just walk out the door without the staff noticing, and sometimes we don't always notice it because they're following family. So we've had an incident like that before too, when the family thought that their loved one was at the facility. He accidentally wandered out after them and wandered off in different directions. So it was good. We were fortunate because it was in Winslow, and PD was able to navigate to locate the person. Um, so those are some of the things we run into. But I do have another coworker who had one. Um, Another member of hers was found on a weekend, and the family did not know that she wandered all the way to Winslow, and the family didn't
Mhm.
care to check up on her until PD found her behind some building in Winslow too. So those are some of the things we run into, and it's really hard to explain to families what dementia and Alzheimer's is and how quickly it can advance. So a lot of the times, as case managers, and I'm very new to case management. I've only been with the program for 3 years, coming off a totally different field and coming into this program, but I have a lot of I would like to find a lot of connections with other resources that will help me help my members and their families to become very aware for their loved ones. So I would like to connect with you guys and see if we can get
Mhm.
those flyers out to our office so we can have them posted in our front offices and in places where families can find them.
Yeah. Yeah, that'd be great. If Rhonda, will you send me an email? Because a couple things. So one great way to help families kind of learn about dementia and things is I don't know if you guys do any kind of community events or maybe events at the elder care homes or something, but we have one of our resources that you can order is dementia bingo. And there's so it's a fun way to kind of introduce or and address dementia and talk about dementia. And it kind of gets people to loosen up a little bit because it's, it's not a really fun topic to talk about, right? So, or you can do it like at a community dinner or do some kind of event and do dementia bingo, and the families can be involved. So that's kind of one fun way. And there's also a video on the website that you can show before the dementia bingo that gives that basically gives the answers to the dementia bingo beforehand, and then you play the dementia bingo.
That'd be
Um,
great because we have a winter session coming up. I don't know if you guys would be interested in presenting to the entire staff because we do have a winter session that we do for all the case managers and for social services. They're always finding presenters, so I will send your info to our main office to see if we can get you on the agenda because
yeah.
we've had other programs that have come on explaining dementia and Alzheimer's, but they never really talked about the resources of ways to explain stuff.
Mm,
They've always kind of zipped through their presentations. I'm not bashing those guys, those programs, but this is like a new one. And I'm glad I registered when my supervisor gave me the email. And I think I'm the only one that registered from my office, but I always share with my coworkers. So the presentation you send to me, I
mhm,
will share with the staff here, and I will shoot an email to you. And I believe we are planning on meeting with our clients. So we did our first session with them this past March. We're planning on another session with them. So this will be a great way to bring you guys back out a second time just for our members and their families because they do come out and join us
yeah.
when we ask them to.
Oh, yeah, that'd be great. And we'd be happy to present. If there's anything specific that you feel the community needs information wise, um, you can just let me know, or we can chat and we can talk about that so that if we need to tailor it a little bit to the community, if there's like some certain needs, um, that we can kind of focus on, feel free. So when we talk, we can do that. So you can email me, and maybe we can set up a time to Zoom and talk about that. And the other thing I wanted to, ask you to email me is because I would really like your input, and anybody else on the call who is kind of in this space with the Navajo Nation. We're going to contract with a search and rescue expert from the Navajo Nation. And so we're in talks with her to contract. She's a disaster relief expert. She's worked in crisis response teams, all kinds of things. So we're going to contract with her to help us implement this in communities. And so having people's perspective, especially from, like, she has, what am I trying to say? Like, she knows, like what you just said about tribal government or tribal police being difficult to work with the tribal police or whatever the case may be. And so having that kind of input in our learning community is invaluable, because I don't live on the Navajo reservation. I'm not Dene, so I don't know how that community works, but she does, and you do. And so that will help it, and every community is different, we know that, but having that kind of perspective, especially on such a large nation, will help us and help inform us on how to implement this in the best way, how to approach tribal government, how to work with the tribal police, that kind of stuff. And anybody else on the call, if you have relationships or you have insight into the way your tribal government works or your tribal police, we would love to have that in the learning community to be able to talk about that. And when we help people walk through this toolkit, we'll kind of have more information on how things work in different communities.
So Rhonda, thank you very much for your question. And so that's the purpose of having a question and answer session, because this is your opportunity to make those connections and obtain assistance. So Trudy asks, what are some of the common barriers with tribal police in putting out an elder wander alert?
So I would say some of the kind of real basic ones are there's not enough police staff to respond to your call because they're understaffed. Another one is in a large geographical area, maybe it takes a long time for the police to respond. For example, one of our community partners in Alaska, their agency having jurisdiction is the State Patrol, and it takes them 6 hours to arrive because they're so rural. Another one is, perhaps the tribal police, and it could be other police agencies too, they just don't think it's a priority because they have crimes going on. And so they have to go arrest criminals and they don't have time to go looking for grandma. They can be very dismissive, police, about things like this. So that, and then just time. So, it can take them time to respond, and then they have to, the wandering elder has to meet certain criteria, and then that has to be approved by whoever approves that, and then the alert goes out. So it kind of like the duration of time for the alert to go out. Those are the ones I can think of. If you guys can think of other things, or if you've had experience with other things, I'd love to hear about it. Does that answer your question, Trudy?
Okay, she does the little heart emoji, so yes.
I love it. I love it. It's perfect.
We do have another one from Pam. Is there a way to put a guard bracelet with name, date of birth, and on all exit doors? Is the unit that when the bracelet gets too close will go off?
Okay. I'm not familiar with that particular bracelet, but it sounds like it's kind of like a sensor bracelet, and they get close to the doors and alarms maybe. I mean, yes. Any kind of, if you can use any kind of tracker or anything like that, absolutely. It's like one more layer of protection, right? But some communities and some people, like, those kind of things cost money, right? So sometimes people can't afford that kind of stuff. I don't know if that's something that's provided by the state or some kind of agency for free, but that the cost can be a barrier. The same thing with like the Apple tags or the, like the other kind of like little trackers. So cost can be a barrier. And in places that are rural or don't have good GPS and cell phone reception, they can become useless if the person wanders into like a dead zone. So then you can't track that person. And sometimes, like my grandpa, my aunts tried to put a tracker in his wallet, and he would find it and he would throw it away. He's like, "What is this?" And he would throw it away. Or some people try to put it in the shoe, but if you can feel it in the shoe, they'll take it out and throw it away. Maybe if you can find a way to like hide it in their belt or something, that could be a possibility. But you got to make sure it's charged. You got to make sure they don't throw it away. You got to make sure there's plenty of signal, and then the cost. So if you can do it, definitely do it. It just can be a challenge for certain situations. That's just something to keep in mind.
Great. So are there any additional questions for Megan? I did put her email address in the chat, so you can email her additional questions. Other links to like the dementia bingo she had mentioned, and the link to the toolkit is also in the chat as well. So for those of you who have put your email address in the chat, we will send you the PowerPoint, but the recording and the PowerPoints will be sent to everybody. But that usually takes like at the most 3 weeks. But if you need the PowerPoint sooner, just put in your email address in the chat and we'll send it to you. We also have an evaluation form, so we really want your feedback about the webinar, about the information that you've heard about, and then what topics you'd like to see in the future for our webinars, and any suggestions that you may have to improve the work that we're doing, because our Center for our Circle of Indigenous Power, which is our Native Center for Disabilities, we view disabilities with a public health lens, meaning, we focus on all sorts of issues that would impact the health and well-being and abilities of Native and Indigenous people. So if there are any other health topics or trainings you'd like, just let us know. Okay, let me see. Let me just go back to the chat and see if there's any. Let me see. So there is one wonderful presentation and so helpful. I'm going to pursue this on our reservation in South Dakota. So
Awesome. Great, Pat. And if you need any help, feel free to reach out. That's what we're here for. Also, I just wanted to mention, if you guys are looking for a specific resource, or you're looking like you can't find it, or you're wondering, do you have a resource on this topic? Just email me and I can help you find it. If we have it. Otherwise, I'll put it in the question box to create it.
Okay, so no other questions. I want to thank you very much, Megan, for spending time with us about this wonderful topic of the toolkit, which is much needed, how communities can work to address this issue. As he said, tribal police in many communities are very few, and take a long time to respond to instances of wandering. So however we can do to help our community is much needed. So again, thank you very much.
Thank you.
And thank you everybody for sharing and being on our webinar. And we'll see you when we have our next one. We are hoping to focus on caregiving, again, along the same topics of dementia and Alzheimer's, but caregiving advocacy. And then also looking at advocacy again in the beginning of January. So hopefully you'll join us again.
Thank you so much, Agnes, for the opportunity. And can I join your next caregiving one? Because we're starting to create resources on caregiving.
Yes, I will send you the link once we have that scheduled. So it's going to be, the purpose is really to look at, again, communities developing their own caregiving programs and advocating for caregiving, because a lot of our programs, many times are few and far between. And so what can family members do to be advocates? So
That's great. That's really good. I'd love to hear about that. Thank you so
Okay.
much. Thanks,
Thank
everybody.
you. Bye, everybody.